Okay, thank you very much, Justin. Appreciate it. 7:36 right now. And while New Yorkers are battling one of the worst flu seasons in recent history, there's another health threat that is really causing concern. Chronic diseases like heart disease, diabetes, cancer, the top causes of death for New Yorkers.
So in 2021, more than 30,000 New Yorkers across all ages died from chronic diseases. 40% of those deaths were premature, and the hardest hit are underserved communities. So New York City is trying to address those health inequities. Interim Health Commissioner Dr. Michelle Morse is here now to lay it all out for us. So good morning to you.
Good morning. Thanks for having me.
Good morning. And before we get to that important topic, I want to ask what's going on right now. It is flu season, but we're seeing so many cases of flu, norovirus, RSV. It's like you name it, somebody you know has it, right? So what do we need to know about kind of this influx of cases?
I'm so glad that you're asking the question. This is a top concern for New Yorkers that we're hearing about as well. We are in peak respiratory viral season right now. So flu is dominating. In fact, our most recent data showed that we had about 23,000 cases of flu in 1 week. And that is a very high number. So if you're out and about in the public, on the subway, in crowded spaces, you are likely to come across someone who might be sick. Now, what is important to know, of course, for New Yorkers is you can protect yourself. Number one, it's not too late to get a flu shot. The flu shot really is both life-saving and keeps folks out of the hospital. And it's also not too late to get a COVID shot. Even though flu is dominating right now, we expect that we could see more COVID cases over time as well. And so get your COVID shot as well, and also be sure to use a mask if you know you're going to be in crowded places, hand hygiene, and if you're sick, stay home to stop spreading the viruses.
Just real quick before we get to the report, are people just not getting the shots?
Well, you know, I will say that we have seen a little bit of a drop-off in vaccinations since the height of the COVID pandemic emergency. So we are really trying to get as many folks as possible vaccinated, particularly older folks. I work at Kings County Hospital. I was just there on Friday. I can't tell you how many people are in the hospital right now with flu, COVID, et cetera. So it would be amazing if every New Yorker actually did go out there and get the vaccine.
What surprised me was, I guess, the norovirus, because that wasn't necessarily respiratory.
That's correct. You're right about that. We are seeing more norovirus cases this year than we did last year. Every winter, we do see that season of norovirus. It causes diarrhea, vomiting, really unpleasant symptoms. It isn't respiratory. It is spread really through contact. And so just your normal hand sanitizer may not do it actually for norovirus. It's very resistant. You have to wash your hands for at least 20 seconds. You also need to scrub surfaces because it's often spread easily across surfaces. And it's a really unpleasant virus, but usually over in 48 hours. I'm sorry.
You don't need to tell this
Not
guy.
fun. Not
Super
fun.
unpleasant. Okay.
Absolutely.
Thank you for that. Let's talk about this roadmap that you guys released right in the department, right, on how there's a number of chronic diseases that we're seeing. We laid some of that out, and how we can ensure that New Yorkers really do live longer, because right now the study is a little bit of alarming.
Absolutely, absolutely. We have set a goal that we want to improve longevity across New Yorkers to 83 years by 2030. That's because we lost a lot of life expectancy years, unfortunately, during the pandemic. So chronic disease is the #1 killer of New Yorkers. That includes heart disease, diabetes, cancer. So this report is really a whole of government response. Over 22 agencies across city government were involved. And us at the health department, we know we can't do the work to prevent chronic disease without our sister agencies. We need social services, we need health and hospitals, we need all of our partners, including parks and others, to really come together to say these are the things that can prevent chronic disease. And so we're really excited about the report. We have 19 new initiatives that are described in the report, and some of that work is already starting to happen, which is very exciting.
And part of it is focused on the different communities that are underserved right now, right?
That's
brown and black communities.
That's
How
correct.
are you dealing with that?
Absolutely. I'm so glad you asked the question. Data is our superpower in public health. And what our data tells us is there are certain neighborhoods and certain racial and ethnic groups that have a more unfair rate of chronic disease. That's not because of anything that they've done. It's really a legacy of history, of investments, of choices, frankly, that we have made as a society. So it may be very easy to find healthy food in this neighborhood and not so much in this neighborhood. In fact, what we know is that diabetes, for example, 2 times higher higher rates in very high poverty communities as opposed to low poverty communities. So that tells us at the health department we have to focus our interventions and our resources according to need. And that's part of what we do in this particular report, is really look specifically at where we should focus.
Yeah, and with all due respect, it sounds like these things have been talked about for quite some time, right?
That's right.
These are not necessarily new
That's right.
findings, because these have been widespread for quite some time. So how
That's
do you
right.
implement the change now
Yes.
rather than talk about it and then do it in the future?
Absolutely. So our big challenge, of course, the city is large,
Yeah.
and
Yes,
chronic
it is.
diseases are very common. I'll say that one of the things that I think is the most impactful that we're doing that is somewhat new is an expansion of our community health worker initiatives. The reason I mention that one is because it really is citywide. We've been able in just the past year to have 250,000 screenings for health and social needs and vaccination referral in communities all across the city who want more access to care. The reason that is new is because we haven't always used community health workers in that way. We also have 35,000 in-person events just in the past year. This is to say to New Yorkers, find out if you have high blood pressure, find out if you have diabetes, and not only that, let us get you to the places that you need to make that care possible. And the final thing I'll mention in terms of what's new, although we are focusing on inequity specifically much more now than we have in the past, one of the things that we've seen is that Black women, for example, have higher rates of death from breast cancer, even though screening levels are similar. The reason that I want to mention that initiative in particular is because now what we're doing is trying to figure out with our healthcare partners, how do we get that to change, right?
Yes.
We've made huge strides in screening, but we have more to do. So that's kind of the next mile of our work in chronic disease.
It was really important work that you're doing.
Thank you.
We appreciate that. And we appreciate you being here this morning.
Thanks so much for having me.
Yeah,
Thank
thanks.
you.